Hello, friends. Let us now learn about the investigations which are important for diagnosing acute pancreatitis. So, acute pancreatitis ultrasonography is helpful in detecting acute pancreatitis. In the ultrasonography, we can detect the presence of gallstones, which are one of the risk factors for detecting acute pancreatitis. We can also detect the presence of bile duct dilatation, or if there is any obstruction of bile duct can be detected in acute pancreatitis. Then this will also help to diagnose unsuspected acute pancreatitis also. This is also helpful for diagnosing unsuspected acute pancreatitis, or to confirm the diagnosis of acute pancreatitis, we can use the ultrasonography. Ultrasonography can also be used to do guided aspiration and drainage if there is any pancreatic collection or anything in the pancreas. Then, followed by ultrasonography for the acute pancreatitis, CECT can be done. Actually, CECT is indicated in patients with severe pancreatitis. It is mainly indicated in patients with severe pancreatitis. And the CECT is also used to diagnose, it is used to diagnose pancreatic necrosis also. This CECT is also used to diagnose pancreatic necrosis. In pancreatic necrosis, if more than 30% of the gland or 30% of pancreas is affected, then it is called as pancreatic necrosis. And if there is involvement of more than 3 centimeters of pancreas, more than 30% or more than 3 centimeters of pancreas is involved, then we can think that it is pancreatic necrosis. Treatment of this pancreatic necrosis is we can give prophylactic antibiotics to the patient. This giving prophylactic antibiotics will actually reduce the sepsis and mortality in patients with pancreatic necrosis. Then, this computer tomography is also used to diagnose or detect the complications of pancreas. So, there are many complications of pancreas, and these complications of pancreatitis can be detected with the help of this CECT. Then, it can also be used to diagnose other conditions also which might mimic pancreatitis. It can be used for guided aspiration and drainage also. Then the next investigation after CECT is that we can also do an MRCP also. MRCP is helpful for detecting stones in the gallbladder and bile duct. So it is used to detect stones in gallbladder and bile duct. Then we can also do an abdominal MRI can also be done for acute pancreatitis patients. This abdominal MRI is used for the diagnosis of pancreatic necrosis. Then we can also do an MRCP and MRI are also this MRCP and MRI which we have dealt now, these are done if the CECT or if the CT or ultrasonography is inadequate. That is, the information that is provided to see through CECT and ultrasound is inadequate, then we can do this MRCP or MRI. And also it is done if there is contraindication to CECT. If the patient if we cannot give contrast to the patient, or if there are any other contraindications to CECT, then we can do this MRCP and MRI in these patients. We can also do an endoscopic ultrasonography. This endoscopic ultrasound is more sensitive than abdominal ultrasound. It is more sensitive for detecting the gallstones or bile duct stones actually. For detecting the common bile duct stones, we can do this endoscopic ultrasonography. Endoscopic ultrasonography is also used for detecting the suspected gallstone pancreatitis. And we can also diagnose it is also used to diagnose the presence of any pancreatic divisum, or it can be used for diagnosing the microlithiasis, presence of small lithium, small stones, or for pancreatic divisum, we can use this endoscopic ultrasonography. Then we can do an ERCP, endoscopic retrograde cholangiopancreaticography. It can be used in patients with choledocholithiasis with jaundice. It is used in patients with choledocholithiasis with jaundice, and for it can also be used for patients with dilated common bile duct stones, or it is used in patients with acute pancreatitis, or it is used to diagnose cholangitis. So ERCP is mainly reserved for these patients. It is reserved for patients with polydoctolithiasis with jaundice, with patients with dilated common bile duct or cholangitis. Obviously, we are using it to diagnose acute pancreatitis. So it is used for all these patients. So these are the different investigations which can be done for acute pancreatitis. Thank you.